Hi, I'm Dr. Sarah Goddard. I'm a proud Cadiz woman of the Barclay. I work as a rural generalist at Tennant Hospital and Tennant General Practice. My journey in becoming a rural generalist has been tricky. It's been a long one. I was a graduate of University of Newcastle in New South Wales. I then undertook my junior training years at Royal Darwin Hospital and returned back to Tennant Creek to undertake my rural generalist training through Northern Territory General Practice and Education. I've wanted to be a rural generalist for as long as I can remember. There's photos to prove I've wanted to be a doctor before I could just about walk. Rural generalist is the best career choice for me. I work in both general practice and emergency, getting to look after people in the acute care, but also long-term in chronic disease prevention. So my journey started going to school, going to med school, then joining a training program with the Australian College of Rural and Remote Medicine. I then completed my fellowship through them in Tennant Creek, both in Tennant Creek Hospital and Tennant Creek General Practice, attaining my fellowship last year as a rural generalist. It has had its challenges, but most of all it's had its benefits. I'd recommend being a rural generalist to anyone. In Tennant Creek, it's real life medicine. You have the unknowns that walk through the door, you have chronic disease, you have tropical medicines that pass through, you have travellers from down south. It's everything that makes up a rural generalist. Working in the big cities, you don't necessarily get to experience all of this. A lot of stuff can be sub-specialised. As a generalist, you need to go to the bush and work hand in hand with the stuff that walks through the door. My pathway I went through was Northern Territory General Practice and Training, NTGPE. Completed my 4-year program into all of my training in Tennant Creek. So I got to do emergency, general practice, and live in a rural life. I've been pretty headstrong the whole way through. I was always going to be a rural generalist. I was always coming home to Tennant Creek and work in my community. I don't think anything that anyone said to me that wasn't this has stuck. I've just kept my eye on the prize and here I am. Just coming home, walking down in that waiting room and calling someone's name out, realising that I'm their doctor, being able to have babies born, look after them, watch them grow, and also be able to assist people at the end of life. From start to finish, I get to be in my community with my people, helping whichever little I can. There's lots of challenges in life in day to day. Living rural and remote is challenging, isolating, but it usually comes with the benefit of a tight community. You get your work colleagues, you get your community friends, you get to go trips away if you want to. For me personally, I get to be in my hometown. It's the best benefit that anyone can ask for. I get to be around my family, I get to be around my school friends, I get to be where I want to be. I don't have to live out a suitcase anymore, I don't have to fly in, fly out. I'm home and I'm always here. I'd advise junior doctors, medical students, anyone that's thinking about rural generalism to get out there and give it a go from the start. Put yourself in the situations where you need to be prepared to juggle everything. It's worth having the remote experience visited in your junior years and then to build on that coming back and back. I'm a bit different in the sense that I always was going to do it, but once you experience it, even for people who thought they'd never come and do it, once you get a little bite of rural generalism, you'll be back. And the best place to do that is in rural and remote areas, whether that be in the Northern Territory or Australia or out of Australia. Go remote. You won't be wrong. I'm still waiting to be tapped on the shoulder and told it's all a prank and I'm not really a doctor, but I have done it. I have my fellowship. For people who know me, you know I like my horses, rodeo, rural lifestyle, fishing, camping, all the stuff that you can do in a small town. Most of all, I like just spending time with my family and friends. It starts off with getting up, getting the kids organised, taking them to childcare, rocking in for 8 o'clock handover, and then my day begins. It could be in the emergency department, it could be on the ward, it could be in my general practice. And what I plan to come in to do always changes. So you have to be ready to hit the ground and change it at the last minute. I guess you need to be comfortable with yourself. You need to be happy and know that the skills you've gained, you can perform. You need to be comfortable with all areas of rural generalism, whether it be kids, women, men, acute medicine, chronic disease. You just have to take the jump and give it a go. I think you need to be a people's person. I think you need to be able to communicate effectively, listen to everyone's concerns, and know that sometimes you don't actually have to have a skill to do something other than talk to someone. We're very unique in the sense that we have a lot of chronic disease. We have a large Indigenous population, and we have a lot of illness that most people only ever see in a textbook. Going rural or remote throughout the Barkly, you see first-hand medicine that not everyone does. You get to deal with rheumatic heart disease and post-strep glomerulonephritis. You get to deal with young people having cardiac issues. You get to deal with diabetes from all spectrums, from first preventative screening through to end-life complications, dialysis. I have an amazing husband. I have an amazing family. I have great colleagues that I work with. I get people that fly in, fly out. I might be the only crazy one that lives here full time, but I wouldn't have it any other way. I know there's always someone on the end of the phone that I can rationalise with, discuss the case. Only that I'm very biased, and rural generalism is the way to go. You get to do everything in medicine, not just one area.